Thanks for having me here today to speak. Very happy to be here. It's an honor. So I'm going to be speaking about the importance of glutes and principles of core stabilization. I have no relevant conflicts of interest or financial disclosures. So the plan in the next 10 to 12 minutes is a brief introduction into core stabilization and glutes, pertinent anatomy, in particular anatomical slings, as well as activation patterns, both in normal and pathological states, key exercises and what are the best exercises to target the glutes, followed by a brief conclusion. So to start off, musculoskeletal injuries, as we all know, are really prevalent, and all injuries have the potential of either disrupting the core or maybe due to a dysfunction of the core musculature. So there's a lot of descriptions that have been thrown out there about what core musculature is or what core stability is. Some of these terms might include lumbopelvic stability, neuromuscular control, or firing patterns, as well as strength. In reality, the core stability encompasses all of these aspects. Today, I'm going to draw particular attention to the gluteus maximus because I feel that it's kind of the forgotten glute. It's over the last several years, it's fallen on the wayside, and gluteus medius has gotten a lot of attention in research and exercises as well. But it's important to note that gluteus maximus in a normal functioning human is actually the most powerful and largest muscle in the body. Its average weight is 844 grams, which is more than double that of both the glute medius and minimus combined. So it is very important in rehab and in normal functioning. So there's been considerably less research recently to address inhibited and atrophied gluteus maximus. And really in recent years, it's mostly research from the bodybuilding world and athletic trainers that have brought it to the forefront on how it's important to build and develop that muscle for a lot of strength and athletic ability. And so this is now trickling into more traditional physical therapy or rehabilitation in medicine. It has multiple roles as a local stabilizer. Some of these include stabilizing at the lumbosacral spine through deeper connections with the erector spinae, as well as the thoracolumbar fascia, sacroiliac joint as well, and bracing and compression. It also has a role in femoral head stabilization in the acetabulum, and a possible role even in knee extension stabilization via iliotibial band attachments. In our world today, with our lifestyle, this promotes gluteus maximus dysfunction, especially with COVID and everybody being remotely, just like today. Prolonged sitting does reduce activation. And there's also inhibition that happens due to overactivity of the hip flexor muscle group that becomes tight. And so when gluteus maximus is elongated, this also puts it at a mechanical disadvantage. Pain can also be a major inhibitor of gluteus maximus and can contribute to delayed and decreased activation. And pain doesn't necessarily have to be locally. It can even be from distal segments at the lower extremity that deactivates gluteus maximus. So we're going to continue on to the anatomy. The core can be defined as a muscular box where anteriorly the wall is the abdominal wall. Posteriorly, we have the paraspinals and the gluteal musculature. Superiorly, the diaphragm, and inferiorly, the hip girdle and pelvic floor musculature. Core has multiple functions. The main functions are to distribute forces appropriately across the axial skeleton and allow for maximal strength at the segments to be generated. Some basic concepts on muscles in core stabilization. We have local and global muscles that play a role in lumbopelvic stability. The local muscles are really our deeper layers that have origin or insertion points directly or indirectly on the lumbar vertebrae and provide direct lumbopelvic stabilization. Some of these muscles include multifidus as well as transverse abdominis. Our global muscles are more the superficial layer, which span across multiple segments, and they generate large amount of torque, such as rectus abdominis and our obliques. There's a concept in anatomy and core stabilization on anatomical slings that I wanted to discuss about because this is forms of movement. And so traditionally, there's 4 slings, anterior oblique sling, posterior oblique sling, deep longitudinal sling, and then the lateral sling as well that's reported. And so if we consider the anterior oblique sling includes external oblique, internal oblique, or transverse abdominis is there, as well as the contralateral adductors that function together to transmit muscle movements. The posterior oblique sling includes the latissimus dorsi, thoracolumbar fascia that plays an important role in connecting our spine to upper and to the upper and lower segments, and our famous gluteus maximus contralaterally that's very involved, as well as the iliotibial tract. The deep longitudinal sling includes the multifidus as well as the sacrotuberous ligament. And finally, the lateral sling is also reported in studies, and this includes more the gluteus medius, minimus, our TFL, and our IT band. Getting into muscle activation patterns. Some general principles to keep in mind: if a prime mover is weak or inhibited, lower is going to have lower activation strength, and synergistic muscles are going to compensate or take over. If a muscle is tight or shortened, muscle may be recruited earlier, and this may throw off balance of normal patterns of activation. And so different patterns of inhibition, weakness, or tightness can alter our normal movement patterns and lead to injury. In terms of the transverse abdominis, some studies have shown that in healthy subjects, the transverse abdominis involved in core stabilization needs to activate before any limb movement, and that includes both the upper and lower extremities. So once you think about doing a movement, your core, which is your foundation, should be engaged and active before you move any segment. In low back pain, it's been shown that transverse abdominis is delayed in activation relative to the prime mover of the limb. So we have these abnormal patterns, and that's going to be key when you're trying to treat, either persons with low back pain or higher level athletes. You need to come back to basics, your foundation, which is the core. And transverse abdominis corresponds in the available literature and research that's been done most consistently and significantly to the delay in onset of core musculature. Even just after a few days of back pain, there's a delay that already sets in. And this it corresponds to change in the coordination of the postural response by our central nervous system. Another study showed evaluating EMG activity at the abdominal muscles, lumbar, multifidi, and deltoid with shoulder movements, that transverse abdominis was the first muscle active regardless of the arm direction, just showing furthermore the importance of our core muscles. Diving into the glutes. So gluteus maximus is a major stabilizer of the pelvis, especially during trunk rotation and any shift of center of gravity. It's also the primary mover in hip extension. Other studies with persons with low back pain or even lower extremity instability have showed poor endurance and delayed firing of gluteus maximus. Normally, studies have shown that there is a side-to-side difference in strength in gluteus maximus, implying a normal lateral strength dominance. And so the hip extensors are actually stronger on the contralateral side to the hand dominance, whereas the hip abductors, including gluteus medius, is stronger ipsilaterally. With injuries, this difference was also altered, and especially in women. So one study showed that female collegiate athletes with low back pain, hip extensor strength was significantly more asymmetric, whereas in lower extremity injury, we lost that asymmetry and they were more symmetric compared to normal patterns. And so that's interesting to note. Female athletes are at greater risk of upper extremity or lower extremity injury if there are hip extensor or knee flexor imbalances of greater than 15% on either side. And that's also kind of important to note how we can potentially predict some of these injuries. Different hypotheses why women may be prone to changes in side-to-side hip strength. Some of it might be the anatomy, greater width of the pelvis. Other factors might be gait biomechanics that are different in men or women, as well as plane style in women that might have a more upright trunk positioning that might make them more sensitive to these changes. We talked about synergistic movements, and that gluteus maximus is really the prime hip extensor, or should be. And so it's an agonist with a hamstring. So it might actually play a more important role in hamstring injuries than we initially think about. A case study was published examining an elite triathlete with persistent hamstring cramping for multiple years. They did an assessment on EMG and noticed that there was weakness in gluteus maximus, as well as overfiring of hamstrings. And so the program focused on strengthening gluteus maximus instead. And then that athlete was able to go on and finally avoid having hamstring cramping. And so that's something I've shifted in my practice and seen with runners or other athletes or weekend warriors coming in with persistent injuries, really looking at the whole movement patterns and trying to change the biomechanics as well as the firing patterns. And so don't forget about your gluteus maximus. Atrophy is also associated with chronic low back pain. A case control study that did a CT scan of 36 women with low back pain and 32 without showed that the cross-sectional area was 6 to 7 centimeters squared less in those with back pain compared to controls. So the role may be more important than we have originally thought for in low back pain. Something else to keep in mind, gluteus maximus will also compensate for fatigue erector spinae. So it does have an important role. Gluteus medius also obviously serves as a pelvic stabilizer during single leg stance. It's the primary mover in hip abduction. One of the studies with Nadler showed no significant difference in gluteus medius strength with female athletes, but another study in chronic ankle instability did show a delay in ipsilateral gluteus medius, coming back to our movement patterns and timing and neuromuscular control. And another study following knee surgery showed a significant deficit in strength of ipsilateral gluteus medius as well. So something to think about, always come back to your core, and your glutes play an important role. Other studies show that in low back pain, gluteus medius has decreased strength, more pain and tenderness at this level. In fact, another study showed that with bilateral gluteus medius activation patterns, they were able to predict 76% of participants who would develop low back pain that did not have low back pain. So maybe some predictive factors in there as well. Finally, just a brief overview of exercises. So now that I maybe convinced you of the importance of glutes, what exercises actually strengthen or target more gluteus maximus? And it might not be some of the more traditional exercises we think about. Of course, a muscle cannot be specifically isolated, but you can preferentially activate that muscle. However, if it's already inhibited, it won't activate correctly. So always come back and think about, is my muscle firing? What about the neuromuscular control? And you will get co-activation with the other glutes. If we talk about the more basic exercises, the top exercises shown in the available research for gluteus maximus activation includes body weight glute or hip bridges, single leg bridges, especially maintaining that knee flexion to deactivate your hamstring and preferentially activate gluteus maximus. One of the best ones is quadruped hip extensions, which we'll come back to in another slide where I have a picture. Sideline hip abduction as well, but that one will co-activate gluteus medius preferentially. And our clam exercises sideline actually preferentially target gluteus maximus first, and second gluteus medius, and third TFL. If we want to progress some of these exercises, as we know, squats, single leg squats, lunges, and step-ups can also target these. If we go into advanced, more specific gluteus maximus strengthening, you're talking about heavy barbell hip thrusts, which I have a picture of that as well, which is basically your hip bridging, but adding weights. Pendulum quadruped hip extensions, heavy back extensions, and standing or seated band abductions are the top exercises. So the two top exercises for gluteus maximus, barbell hip thrust, so a modification of your traditional hip bridging or glute bridging. In here, what we see is that there's a barbell that has been placed over the pelvis. And the picture here shows a bench. So if you want to move through full range of motion, this will allow you to work the muscle through full range. There's actually much greater activation on EMG versus your traditional back squat or split squat. And so this will really target a lot more your upper glutes, your lower glutes compared to some of the other more traditional exercises. The second best exercise for gluteus maximus is your quadruped hip extension, which we can see over here. And a study in 2006 showed that this exercise using only body weight activated gluteus maximus more than a 1 rep max squat. And it also showed the greatest level of activation for gluteus medius as well. So if you think I want to build my gluteus maximus or activate, these are the best two exercises and go-tos. So there's ways to have basic and then progressive for your higher level athlete. So in conclusion, core strength and stability encompasses all of lumbo-abdominal pelvic musculature, as well as the osseous ligamentous structures, acting in an optimal sequential movement patterns. A stable foundation really optimizes distal movements. You need to consider a lumbo-abdominal pelvic stability and gluteal function, even for distal limb problems. And the key players are our transverse abdominis, multifidus, and our glutes, but in particular, gluteus maximus has a very important role. More research is needed into identifying normal and pathological patterns to establish optimal exercise programs. And with, the advent of technology, AI and machine learning, maybe there's a way to utilize and harness that to be able to advance our knowledge and our role really in understanding these patterns. These are some of my references, and I thank you for your time. I don't know if anybody